Hello, you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I help you become aware and sensitized about the different surgical conditions. Today's video is about cellulitis. Cellulitis is the inflammation, that is irritation, of the second part of the skin, that is the dermis, as well as the tissues below the skin, the subcutaneous tissues. This inflammation, this irritation, usually occurs as a result of infection by bacteria. Commonly the Streptococcus pyogenes, that is in 2/3 of the cases, and Staphylococcus aureus in 1/3 of the cases. These are just names that we give to these bacteria that cause cellulitis. Cellulitis commonly occurs in the lower limbs, specifically the legs, the feet, and the toes. But it can also be found in the upper limbs, for example, the arm, the hand, and the fingers. We can also find it on the face. The individuals that are affected commonly are those that have a wound on their skin. For some reason, it can be through a piercing, a tattoo, it can be a road traffic accident, it can be a bite, for example, a human bite, an animal bite, an insect bite. As long as the skin has been breached, these individuals are susceptible to getting cellulitis because that can be a port of entry of the bacteria into the skin, into the body, and then they can end up with cellulitis. Cellulitis is also common in individuals that have a low immunity. For example, they have HIV, they are on steroids, anti-rejection drugs. For example, they underwent an organ transplantation, individuals that have diabetes mellitus, and individuals that are on anti-cancer medications. It is also common in children, obese patients, alcoholics, as well as individuals that have a poor hygiene. Cellulitis can also be found in individuals that have chronic skin conditions, for example, psoriasis and eczema, as well as athletic foot. It can also be seen in individuals that have some conditions that can affect the skin, for example, venous insufficiency. Venous insufficiency is when your veins are not working well, and instead of the blood being taken to the heart, the blood comes back to where it came from. For example, if the blood was coming from the feet, being taken by the veins to the heart, if you have a problem, for example, with your valves, the blood is going to backflow, and then you can start getting some skin changes, and this can predispose you to cellulitis as well. When it comes to the signs and symptoms of cellulitis, the very first thing that will happen is skin changes. The skin of the affected area will look red, purplish, and eventually it will look darker than the opposite side that is not affected. And after some time, there can also be some blister formation. The area will also look lumpy and some kind of pitted, more like an orange peel. And there will also be some pain emanating from the area, tenderness, that is when you touch the area, it will be painful. There will also be some swelling of the affected area. The affected individuals can also present with fevers, fatigue, and chills. The area will also be warm to touch in comparison to the side of the body that is not affected. The diagnosis of cellulitis in majority of the cases is purely clinical. That is, we do history taking and clinical examination. However, in severe cases, we have to do some investigations, especially if the cellulitis is not responding to the medications that are commonly used for cellulitis. For example, we can do a complete blood count, we can do a culture and sensitivity from the fluid from the blisters. We can also do a tissue culture and a blood culture, just to make sure that we know the bacteria that is causing the cellulitis, such that we can tailor our medications, our antibiotics to that. When it comes to the treatment of cellulitis, we recommend supportive management and the use of antibiotics. Supportive management entails elevating the affected area. We can also use the non-steroidal anti-inflammatory drugs, for example, ibuprofen, aspirin. This will help to reduce the pain, the swelling, and the tenderness. The definitive management of cellulitis is antibiotics, and the commonly used antibiotics are the first generation cephalosporins, for example, cephalexin. We can also use penicillins, for example, dicloxacillin or cloxacillin. And also other penicillins have shown to work, especially those that target Staphylococcus aureus and Streptococcus pyogenes, because they are the two commonly implicated bacteria. When it comes to the prevention of cellulitis, I want you to remember that the two key predisposing factors to cellulitis are trauma to the skin and poor hygiene. So this means you have to be careful not to cause trauma to your body. Please take the necessary precautions to avoid trauma to your body, because the wounds that are sustained from trauma can be a portal of introduction of the bacteria into the body, and then cellulitis will occur. Please also exercise a good personal hygiene. This can be done by regularly washing your hands with soap and water or using an alcohol-based hand rub. Please also trim your finger and toenails, because if the nails are long, they can harbor bacteria. Please also shower daily, and when you shower, please make sure that your entire body is dry, because bacteria tends to grow in areas that are wet. And if you ever sustain any wounds on your body, please visit the nearest hospital such that the wounds can be cleaned. And if they are deep wounds, let them be sutured, and they should be closed until stitch removal has been done, and the dressing should continue until after a month from the time you had the injury. This will allow the wounds to be protected from introduction of bacteria, because remember, the skin, which was supposed to protect the bacteria from entering the body, has been breached. So that means you have to protect this wound from any contaminants from the environment, including the bacteria. Please also refrain from touching the wounds with your bare hands, because this can cause an introduction of bacteria into the wounds, and you might end up with cellulitis. That is what I had for you. Thank you so much for listening to me. Please share my videos and also subscribe. See you in my next video. Bye.